Welcome to Mansik Shakti Foundation. We are conducting this course called Mind Sciences for students, in which we provide mental health education or education regarding challenges of their life. One of the challenges that they face is about mental illness. Some students, like anyone in society, is likely to develop mental disorders, and therefore it is important that everyone, all students, teachers, principals, all stakeholders, parents must know what is psychiatric disorder, how it develops, how to identify, and what is the treatment, what can happen to my sons and daughters. We were talking how mental disorders develop, and it is a consensus that nobody knows exactly how. Some factors which are well understood and everyone is in consensus with is that no single factor can cause a mental disorder. It's because of unique combination of biological, psychological, social, cultural, environmental and spiritual factors put together over a period of time in person who is vulnerable or carries a risk for developing a mental disorder. That is how mental illness appears. It is dysfunction of psychological characteristics, psychological functions, and when it starts affecting your daily life functioning or causes distress, then it's a matter of concern. It's called a disorder. Generally, mental disorders develop among vulnerable people. People who have mental disorders in their parents or in other family members biologically related to them are at a higher risk. The disease develops very early in life. Besides family history, emotional experience, psychological stress, and social conditions play a very important role. A positive experience protects an individual while an adverse experience increases the risk. The complex relationship between biological factor and social conditions also became much clearer when it was demonstrated that social factors may directly cause a detrimental effect on brain. Several substances which connect brain cells and allow their normal function can increase or decrease. This cannot be generalized since for some psychiatric conditions there are no brain changes. However, more research is being done to investigate this aspect. Progress in this area will ultimately unlock the secret of biology of major psychiatric disorders and the mechanisms of action of drugs that are effective in treating these disorders. Similarly, it was observed that severe psychological stress also causes changes in the brain. Genetic factors, including a person's individual genetic makeup, may put them at a higher risk for developing a mental illness. Factors can also include like physical trauma such as brain injury or misuse of substances such as street drugs or alcohol. Having a close family member with a mental illness can increase the risk. However, just because one family member has a mental illness does not mean that others will. Having a gene with links to mental health conditions such as depression or schizophrenia does not mean that an illness will develop. Likewise, people without related genes or a family history of mental illness can still have a mental health issue. Certain genes may increase one's risk for developing a mental illness, and your life situation may trigger it. Environmental factors that can negatively impact a person's mental health can include severe psychological trauma such as war, sexual abuse, social factors such as where we live, where we have strong support network like close family, friends who make us feel safe and secure and who can rely upon, and our work environment impact our mental well-being. Amount of stress people are under and the duration of that stress can impact one's mental health, especially in a situation where individuals are unable to change their circumstances. Illicit drug use can trigger a condition such as manic episode like bipolar disorder or an episode of psychosis which looks like schizophrenia. Negative childhood experiences such as abuse or neglect can increase the risk of mental illness. Trauma and stress, traumatic life events, or ongoing stress can also cause social isolation, domestic abuse, etc. Similarly, violence, relationship breakdown, financial stress, work problem, they all can act as a severe potential precipitating factors. Traumatic experience such as living in a war zone can increase the risk of conditions like post-traumatic stress disorder. Personality factors like some traits such as perfectionism or low self-esteem can increase the risk for depression or anxiety. Environmental exposure before birth, inflammatory conditions, toxins, alcohol, drugs while in womb can sometimes be linked to mental illness. Neurotransmitters are the substances which are chemical communique in the brain. These are naturally occurring substances which carry signals to other part of the brain and body. When neural network involving these chemicals are impaired, the function of nerve receptors and nerve system changes, leading to conditions like depression and other emotional states. Similarly, brain damage as a result of a serious injury, such as a violent blow to the head, traumatic experience such as military combat or assault, use of alcohol or recreational drugs, a childhood history of abuse or neglect, few friends, few healthy relationships, a previous mental illness. These are some of the risk factors which are potentially related to causation of mental disorders. Main factors which increases the risk of developing a mental illness includes a history of mental illness in a blood relative such as parents or sibling, a stressful life situation, financial problem, or death of a loved one or a divorce, an ongoing chronic medical condition such as diabetes. The effect of mental illness can be temporary or long-lasting. You can also have one or more mental health conditions. Some of the symptoms are worth recognizing. A mental illness can cause problems in your daily life, such as at school or at work or in relationship. In most cases, symptoms can be managed with a combination of medications and treatment of talking, support, talk therapy, counseling. Signs and symptoms of mental illness can vary depending upon the disorder, circumstances, and other factors. Mental illnesses can affect emotions, thought, and behavior. Feeling sad or low down, confused thinking or reduced ability to concentrate, excessive fear or worry, extreme feelings of guilt, extreme mood changes of high and low, significant tiredness, low level of energy, sleeping less or more, detachment from reality. That means not realizing where you are, how you connect with the environment, paranoia or hallucination, inability to cope with daily life problems or stresses, and trouble in understanding and relating to situation and to people, problems with drugs or alcohol, major changes in eating habits, sex drive changes, excessive anger, hostility or violence, suicidal thoughts. These are the common symptoms that we see when mental disorders start appearing. Now, how they take shape, how much they will persist, for how long, it depends upon the underlying conditions, how severe the condition is. Therefore, in order to screen, identify, diagnose one must be aware, and education about mental health conditions is extremely important. Mental health conditions are not psychiatric disorder. One may have mental health condition, that means you are unable to cope with a certain situation and you need help, simple. Or you may have mental health risk, that means you are going through a crisis period due to which you may develop a certain mental disorder. For example, divorce, financial crisis, relationship problem, etc. Or one may have a mental disorder. For example, one may have persistent ideas of sadness, ideas to die, feeling hopeless, sad, having loss of appetite, and host of other criteria which are there for more than a couple of months. And we call this condition as clinical depression. We'll continue to talk more about it.